am Anne Imperial and we are a parent of 2 children.
Hi, I am Gwen and I am a mother of a 4-year-old girl.
Well, for us, nakakatakot kasi because what's the worst thing that could possibly happen if ever mapabakunahan namin sila, di ba?
At saka, di naman natin sigurado na gagana yung mga vaccines na binibigay nila. Mas mabuti pa yung mga halamang gamot na pinapainom namin sa mga anak namin. At malay natin, pineperahan lang tayo ng mga hospital na yan.
Honestly I don't have any idea how vaccines work. Hindi ko nga alam kung bakit kailangan natin ng vaccine eh. Kasi nung bata ako, di naman ako nabakunahan. Okay naman ako. Yun.
In the Philippines, an estimated 2.9 million Filipino children are reported to be unvaccinated and remain vulnerable to life-threatening diseases such as measles, rubella, and polio. The measles immunization coverage in the country has declined at an alarming rate, from 88% in 2013 to 73% in 2017. In 2018, measles immunization coverage was recorded at less than 70%, far below the 95% required for population immunity.
Public hesitancy, vaccine stockouts, the lack of aptly trained health workers, and accessibility of hard-to-reach areas put many children susceptible to diseases. So, this leads to more outbreaks and put more children at risk of getting sick from life-threatening diseases.
These diseases can be fatal, including tuberculosis, whooping cough, measles, mumps, rubella, and influenza type B, which can be passed on directly through the respiratory droplets that are produced when sick people cough and sneeze, share food and drinks, and have wounds that are exposed, all which could be preventable by vaccines.
Vaccines have a weakened or inactive parts of an organism that cause the body's immune system to react. Instead of the antigen itself, newer vaccines have the instructions for making antigens, whether the vaccine is made up of the antigen itself or a plan for the body to make the antigen. This weakened version will not cause the disease in the person who gets the vaccine, but it will cause their immune system to respond in a way that is similar to how it would have reacted the first time it encountered the actual pathogen. Some vaccines need to be given more than once, usually weeks or months apart. This is sometimes needed to let the body make antibodies that last a long time and make memory cells. In this way, the body is trained to fight the specific pathogen that causes the disease. It remembers the pathogen so it can fight it quickly if it comes into contact with it again in the future. Immunization saves lives. One of the things we know is that there are many children living today merely due to the institution of vaccines. Vaccinations are one of the most important things you do to preserve the health of your child, and this could prevent major diseases on a long-term and sometimes in a lifelong basis. A lot of diseases that cause serious and fatal infections are still around, and there are still people that appear to have forgotten how little these diseases are.
I am a mother who is in favor of vaccination, and I believe that it is important to obtain right information from appropriate sources. There are those people who believe that they already know what is best for their children, but we need to have faith in our medical professionals since they conducted research and testing to demonstrate that these vaccines are safe and effective.
Due to the increasing cases of unvaccinated Filipino children in the Philippines, a law was enacted on June 21, 2011 to mandate the state to adopt a comprehensive, mandatory, and sustainable immunization program for vaccine-preventable diseases for all infants and children. Pia S. Cayetano, Lauren Lagarda, Antonio Trillanes IV, Susan Yap, and Mary Mitsimich El Kahayan Uy were some of the primary authors, co-authors, and sponsors of this law, which was then called the Mandatory Infants and Children Immunization Act, also known as the Republic Act 10152.
Republic Act Number 10152, an act providing for mandatory basic immunization services for infants and children, repealing for the purpose Presidential Decree Number 996. For Section Number 1, this act shall be known as the Mandatory Infants and Children Health Immunization Act of 2011.
Section 2. Declaration of Policy. In accordance with Article 2, Section 15 of the Constitution, it's hereby declared to be the policy of the state to take a proactive role in the preventive health care of infants and children. Towards this end, the state shall adopt a comprehensive, mandatory, and sustainable immunization program for vaccine-preventable diseases for all infants and children.
Section 3. Coverage. The mandatory basic immunization for all infants and children provided under this Act shall cover the following vaccine-preventable diseases: A. Tuberculosis. B. Diphtheria, tetanus, and pertussis. C. Poliomyelitis. D. Measles. E. Mumps. F. Rubella or German measles. G. Hepatitis B. H. Influenza type B. And I. Such other types as may be determined by the Secretary of Health in a department circular. The mandatory basic immunization shall be given for free at any government hospital or health center to infants and children up to 5 years of age. Hepatitis B vaccine shall be administered by any duly licensed physician, nurse, or midwife to all infants born in hospitals, health infirmaries, health centers, or lying-in centers, with obstetrical and pediatric services, whether public or private, within 24 hours after birth. Provided, however, that in cases of infants born in places other than the above, any duly licensed physician, nurse, or midwife who delivers or assists in the delivery of the newborn shall be responsible for administering the vaccine to the latter. Provided further that for deliveries assisted by persons other than the health professionals mentioned above, the infant should be brought to any available healthcare facility so as to be immunized against hepatitis B within 24 hours after birth, but not later than 7 days. Provided finally that subsequent doses of hepatitis B vaccination shall be completed according to the recommended schedule of hepatitis B immunization as may be provided in the implementing rules and regulations to be issued by the Department of Health or DOH.
Section 4 is about the education and information campaign. This section states that all healthcare workers or healthcare practitioners who are administering prenatal care shall educate all pregnant mothers on the importance of giving their infants the basic immunization services, as well as any possible effects of the immunization. The Department of Health, other government agencies, non-government organizations, professional and academic societies, and local government units shall make available appropriate information materials and shall have a system of its distribution to the public. And as a nurse, it is our duty and responsibility to educate and advocate for our clients. And our patients has the right to know the information about the immunizations as a part of our nursing care plan.
Section 5. Application to inform. Physician, nurse, midwife, or nursing aide, or skilled birth attendant who delivers or assists in the delivery of a newborn shall prior to delivery inform parents or legal guardian of the newborn of the availability, nature, and benefits of immunization against hepatitis B and other vaccine-preventable diseases of birth.
Section 6. Continuing education and training of health personnel. The Department of Health, with the assistance of local government units, academe, professional societies, and non-governmental organizations, shall undertake continuing information education, and training programs for all health personnel on the rationale and benefits of, as well as modern procedures for immunization of infants and children against vaccine-preventable diseases.
Section 7. Appropriations. The amount necessary to carry out the implementation of this act shall be charged against the current year appropriation. For expanded program on immunization of the Department of Health, thereafter, such sums as may be necessary for the continued implementation of this act shall be included in the Annual General Appropriations Act.
According to the Section 8 of RA 10152, implementing the rules and regulations, the Department of Health, in consultation with the National Immunization Committee, shall issue the implementing rules and regulations within the 90 days after the approval of this act.
Section 9. Separability Clause. If for any reason any part or provision of this act shall be declared unconstitutional or invalid, the remaining provisions hereof which are not affected thereby shall continue to be in full force and effect.
Section 10. Repealing Clause. All laws, decree, executive order, rules and regulation, or parts thereof of which are inconsistent with this act are hereby repealed, amended, or modified accordingly.
Section 11. Effectivity. This act shall take effect 15 days after its publication in the Official Gazette or Journal or in at least 2 newspapers of general circulation.
Approved by the Speaker of the House of Representatives, Feliciano Belmonte Jr., Secretary General House of Representatives, Marilyn B. Barua Yap, Secretary of the Senate, Emma Lirio Reyes, President of the Senate, Juan Ponce Enrile, and President of the Philippines, Benigno Simeon C. Aquino III. This act, which is a consolidation of Senate Bill No. 138 and House Bill No. 4393, was finally passed by the Senate and the House of Representatives on June 8, 2011. Both the responsibilities of healthcare workers, such as educating pregnant mothers on the significance of immunization, as well as continuing education programs for healthcare personnel. Importantly, the Act specified that newborns and children up to the age of 5 must be provided with free basic immunization at any public health facility in the Philippines. Under Section 3 of RA 10152, the mandatory basic immunization for all infants and children covers diseases such as tuberculosis, diphtheria, tetanus and pertussis, poliomyelitis, measles, mumps, rubella or German measles, hepatitis B, and influenza type B. Increasing the number of people who have been immunized demands a concerted effort from not only medical professionals but also the general public. Although parents and other caregivers bear the primary responsibility for ensuring that their children are up to date on their vaccinations, everyone in the community has a part to play in making sure that the recommended vaccinations are given to all children on time, with particular attention paid to those who are the most defenseless and disenfranchised.
Are vaccines free anywhere in the Philippines?
Yes, all the vaccines are free and must be provided in every public health facility in the Philippines. Local authorities, religious organizations, academic institutions, friends and family of parents who have children, and influential people all have a part to play in ensuring that every child is provided with appropriate information and that the parents are given the ability to make the best choice for their family.
Immunization saves lives.
Immunization save lives.
Immunization saves lives.
Immunization save lives.
Immunization save lives.
Immunization save lives. Immunization save lives.
Immunization save lives.
Immunization save lives.
Immunization save lives.